My name is Belle Downing, and I am a licensed and certified recreation therapist, and I'm also a master's candidate for 2022 in the Community and Therapeutic Recreation Department. As a recreation therapist working in behavioral health, I saw firsthand the need for trauma-informed therapists. With 70% of all adults in the United States having experienced trauma, there is a growing need for healthcare professions to become educated on the prevalence and effects of trauma. So what is trauma? Well, according to the Substance Abuse and Mental Health Services Administration, trauma is the result of an event, series of events, or set of circumstances that is experienced by an individual as physically or emotionally harmful or life-threatening, and that has lasting adverse effects on the individual's functioning and mental, physical, social, emotional, or spiritual well-being. What is trauma-informed care? Trauma-informed care, or TIC, is a framework that uses background knowledge, including the prevalence and effects of trauma, to promote growth and prevent retraumatization. There are 6 principles of trauma-informed care, including safety, trustworthiness and transparency, peer support, collaboration and mutuality, empowerment, voice and choice, and cultural, gender, and historical issues. What is recreation therapy? Recreation therapy is a process using activity-based interventions in a goal-directed environment to promote well-being, psychological and physiological health, and recovery. Recreation therapy can serve populations including behavioral health clients, clients with intellectual or developmental disabilities, spinal cord injuries, or even traumatic brain injuries. Recreation therapy and trauma-informed care. While trauma-informed care has been researched in many disciplines, including nursing, social work, and art therapy, there is limited research on the use of trauma-informed care in recreation therapy practice. Furthermore, recreation therapy curriculums are not standardized, meaning there is currently no procedure to include trauma-informed care in recreation therapy courses. So how could trauma-informed care be beneficial in recreation therapy practice? Well, it could increase client and staff rapport by providing a safe space for clients and helping them feel validated in their experiences. It could also prevent staff burnout and assisting staff to better understand how to address their patients' trauma. It could increase the programming attendance at the facility, prevent re-traumatization of staff and clients, and it could promote the post-traumatic growth of the clients. As the principal researcher on this study of trauma-informed care and recreation therapy practice, I developed 3 research questions to guide this study. The first being, what is the level of knowledge regarding the basic concepts of trauma-informed care? The second being, what is the extent to which trauma-informed care is incorporated in recreation therapy, education, and training? The last being, what factors influence the use of trauma-informed care in recreation therapy practice? Procedures we utilized for the study. For this study, we used a Qualtrics survey that we sent out through the National Council for Therapeutic Recreation Certification to a random sample of 2,500 active certified therapeutic recreation specialists. We sent the study out on March 11, 2022, and expect to see about a 15% response rate based on previous studies that have been sent out through NCTRC. Our survey included original questions as well as subscales from the Validated Trauma-Informed Care Provider Survey. This survey was originally created by the Center for Pediatric Traumatic Stress, which they released a 2.0 version that we utilized in this study. Our questions included sections like demographics, knowledge, education, competence, and barriers. What outcomes do we hope to see from this study? Well, we hope to gain a better understanding of the current state of trauma-informed care in recreation therapy practice and curriculum, as well as the different factors or barriers that impact its use. This research is intended to be featured in future publications to inspire the use of trauma-informed care by recreation therapists in all settings and its inclusion in curricula.